And joining me now is Nova Scotia Premier Tim Houston. Hello, Premier. Always nice to have you on the show. I hope you and your family are doing well. I want to ask you something about today's federal modeling, from Canada's Public Health Agency. It shows that hospitalizations are on the dramatic rise across the country. And this week, Nova Scotia Health postponed all surgeries except urgent and time-sensitive cancer surgeries. What else is your government doing to shore up hospital capacity?
Yeah, thank you. Happy to be back for sure. And definitely the variant is having a dramatic impact on the lives of people in Nova Scotia, across the country and around the world. And our healthcare system is no different. So we're taking steps to protect our healthcare system, to support our healthcare system. That means really focusing on, again, boosters in the arms, with big sense of urgency to get the boosters out there. To get people vaccinated that maybe haven't taken that step yet, whether it's their first or second. So we're really encouraging that. But look, our hospital system, we have about right now in this province about 60 people in the hospital as a direct result of their COVID. They couldn't manage their COVID anymore at home. They're in the hospital, and another 150 or 160 people that are in the hospital maybe for something else, but with COVID. So 200 plus Nova Scotians in the hospital system, every one of those requiring special care, resources of the healthcare system. So it's a pressure for sure. And at the time, our healthcare professionals are dealing with that and the ordinary pressures, and they're doing it all short staffed because some of their colleagues are off. So we definitely know the pressure on our healthcare system. So we're doing what we can to support them. But I'll tell you, our healthcare professionals have really stepped up over the last couple of years, and certainly over the last month. So we can never thank them enough. But the pressure is there. We need to make sure that healthcare system is there for those when they need it in case of an emergency. It could be anyone at any point in time. So, but certainly the pressure is on the healthcare system.
I'm always curious of the people that are in hospital, how many are fully vaccinated? Because I think that is really the statistic that people are now following. I mean, over 85% of people are vaccinated in Ontario, in Quebec as well. But, yesterday it was reported that there were 3 new outbreaks at hospitals in your province. When asked if you would allow, for instance, for unvaccinated health workers to go back to work, you said no. So, what is being done to bolster that workforce? You were saying so many of them, like across the country, it's not unique to your province, are calling in sick.
Yeah, to support those that are there for sure. So that's why, postponing some surgeries, postponing some procedures to kind of redeploy resources within the healthcare system. But to answer your question, certainly a disproportionate number of people using the hospital system are unvaccinated. In this province, Nova Scotia, we're around 91% of people are vaccinated, or one dose, or second dose, and some of them even their booster. So a high percentage. We want to keep moving that up. But the percentage of people using the hospital system, having to rely on the hospital system as a result of COVID, is like 25%. So it's much more higher than the population that's unvaccinated. So that tells us for me, that's confirmation the vaccines work. The vaccines are effective, and there will be breakthrough cases, yes, of course. But what we're talking about is the vaccines help reduce the severity of the impact of the virus on a person. So that's why we want people to get vaccinated. But look, no, we're not. There's no discussion about bringing back unvaccinated workers into the workforce. That's not something we're talking about. But redeploying, postponing, moving things around as we can. Of course, that's a constant management exercise to support those that are on.
All premiers, all premiers such as yourself are trying to, find creative ways to get those unvaccinated vaccinated. Quebec has that anti-vax, the so-called anti-vax tax. That's a real no-no for you, or is that something that you would keep in your back pocket?
Look, what we've taken a lot of steps in this province. We have, you have to be vaccinated. A lot of people are off work in different professions because they're not vaccinated. You have to be vaccinated to go to, certain events, certain public settings. So we've taken a lot of steps. So we'll continue to push people, push the education, try to educate people. If they have questions, reach out. The vaccines are safe. The vaccines are effective. We're seeing that for sure. So we'll continue to work, but we have done a lot already to encourage people. and to move them towards getting vaccinated, and we'll continue
Yeah.
to do that.
So quickly, Premier, can you give us an update, on the federal government's deployment of the Red Cross in Nova Scotia?
Yeah, well, so we feel the urgency to get the boosters in arms and continue the vaccination program. So we're really thankful that the federal government has been there when we've reached out so many times. They're making the doses available. The doses are available, so then it becomes a human resource issue. Do you have enough professionals to get them? So we've reached out, and they're going to help us with Red Cross professionals. Are going to come to the province. I think before the January 24th, sometime between now and then, a couple dozen will come here and set up a clinic and help us get boosters in arms. So we're thankful for that, but we feel the urgency to make appointments available to people, and we are doing that. Hundreds of thousands of additional appointments in the month of January, and people are stepping up and getting those. So we're appreciative of that.